A stroke occurs when there's a sudden loss of blood supply to a part of the brain. This can be caused by a burst blood vessel or a blocked blood vessel. Now, how the person is affected will depend on which parts of the brain have been damaged by the stroke. This film will talk about secondary prevention after a stroke.
Stroke prevention. Treat, modify, adhere. A person who has had a stroke is at increased risk of having another stroke. With second or subsequent strokes, there is often a higher risk of death and disability. There are ways to reduce the risk of having another stroke. We call this secondary prevention. What can be done? One is to treat.
You have been better.
You have been better if I were to be around, right?
Yeah.
Don't worry, I've come back, okay? I went for some small...
Conditions such as high blood pressure, high cholesterol, and diabetes puts you at an increased risk of a stroke. Those risk factors can be managed by adopting a healthy lifestyle and also with medication. If someone has had a stroke caused by a blood clot, then medications can also be used to thin the blood, such as aspirin or clopidogrel. Those medications should, however, not be used by someone who has had a stroke caused by a bleed, also known as a hemorrhage. The cause of stroke will determine what medications are to be prescribed. The patient, if possible, and family members should be educated about the medications prescribed. This here is your antidiabetic medication. Take it one in the morning, one in the evening. If you are thinking about trying traditional or herbal medicines, please talk to your stroke doctor first. Herbal medicines may stop drugs from working properly, which could put you at a higher risk of having a stroke.
It is important that when you are discharged home, well-meaning relatives and friends will bring herbal medications for you to take to improve your outcomes. But it's important for you not to mix your medicines that we give you in hospital with herbal medications, as they may make your condition worse. So we ask you to stick with the medicines we give you in hospital, take your medicines regularly, and follow the instructions of your doctor.
2. Modify. Making changes to your lifestyle can reduce the risk of stroke recurrence. Being more active, watching your weight, stopping smoking, drinking less alcohol, and having a healthy diet can reduce the risk of further strokes.
It's hot.
Thirdly, adhere. You need to adhere to medications. You need to adhere to lifestyle advice given. Good communication and education can encourage adherence.
Any questions? You can write.
Think of what it would be like if you had another stroke because you didn't know what to do to prevent recurrence. How would you feel? Stroke prevention. Treat, modify, adhere.